We acknowledge that Tri-Cities Community Television operates on the traditional, ancestral, and unceded territory of the Coquitlam First Nation. We thank the Coquitlam who continue to live on these lands and care for them along with the waters and all that is above and below. Hi, it's Cathy with Catching Up with Cathy and Tri-Cities Community TV. We are thankful for the library here in Coquitlam for donating their space to us. And with me today is Jessa Turner, the owner of TRUESELF Counselling. And we're going to talk about some difficult topics today having to do with mental health and so much more and what's going on in our community. Welcome to the program. Thank you so much for being here, Jess.
Thank you for having me.
Yeah, of course, of course. So we're just going to get right into it. What made you... what inspired you to become a mental health counselor?
So that inspiration started back when I was a young teen. It started when I lost my sister to suicide when I was 11. So that started many years of being caught up in the mental health system, the psych system. I was misdiagnosed, over-medicated, and it wasn't found until I was 30 that I had been misdiagnosed. So coming through that misdiagnosis really, shed some light on the realities of what trauma can do, how it affects people, and the fact that it wasn't just me that experienced it. Mm-hmm. So that's sort of how I kind of was inspired to get into the field.
Right. You thought, I want to make a difference in people's lives, and I want to impact them somehow, right? And
yeah, right. Because I also experienced a lot of gaps myself, being a patient in the system. Mm-hmm. Mm-hmm. So a lot of flaws because of the fact that it's it's a very systemic process.
Right, right.
They don't deal with, the root
right
of things.
Right. They'd rather medicate.
Yeah, thanks for saying that.
Yeah.
I mean, I even had electric shock therapy treatment when I was 28. And imagine the surprise 2 years later when I was told, oh, you don't need all these medications. You're actually not. I was diagnosed with bipolar and schizoaffective disorder. So they took me off of all the medications when I was 30, and I'm in my 40s now. And it's been a journey, but I know a lot of other people like me out there that suffer symptoms and just, aren't ever really able to see the light.
Mm-hmm, mm-hmm. So you have a practice. Is it in your home, your practice?
So no, I actually have an office in Coquitlam.
Okay, great.
So I do also work virtually from home.
Okay, great.
But I actually just in the last couple of months have started practicing in central Coquitlam out of an office, my office.
Good. Oh, that's fantastic. Good. Yeah. And what is your area of specialization then?
So I don't quite have a niche. I'm kind of fresh into it in the last year. Mm-hmm. Because I have experience in so many different areas myself, I'm finding that I'm kind of, attracted to helping in different areas. Mm-hmm. So I have different populations of clients coming, the majority though being, women dealing with past relationships, exes, anxiety, etc. The list goes on.
Right, exactly.
The list goes on. So, but at this point, it's kind of a wide range.
Mm-hmm, mm-hmm. What are some of the most common mental health challenges that you're seeing in the Tri-Cities community?
How long have you got? I will also mention I do work on a casual basis in the hospital system, in outpatient. So I see the challenges from that area as well, and the challenges, in my opinion, as a whole, would be the lack of support, the lack of services. Just to kind of confirm numbers, there's only 75 beds in Royal Columbian for inpatient psych, and there's 300,000 people in the Tri-Cities. So Royal Columbian serves, not just the Tri-Cities, we know that, but 75 beds for inpatient care.
And there's nothing at Eagle Ridge?
Eagle Ridge has the ability to see a psychiatrist if you go into emergency, but they don't have an inpatient ward.
Right.
The wait list to get help as an outpatient is long. That's kind of all I can say as an employee, but it's long, and so those are major struggles that people seeking help and wanting help are facing.
Right, right. Yeah, only 75 beds and 300,000 people in the Tri-Cities. Definitely, we need some more space, and those numbers don't really match.
No, they're quite.
It's like 2.5%.
They're quite extreme, and there's 105 beds for the addictions and mental health aspect of things, which is excellent. But the inpatient treatment, which can be quite effective, there's just not enough.
What therapeutic approaches or techniques do you use in your practice?
I am a big believer and fan of both CBT, which is cognitive behavioral therapy, as well as narrative therapy, which in the narrative therapy approach gives the clients the opportunity to essentially narrate their story, and it's through the narrative that the modality is drawn from. I experienced and have witnessed the benefit of just being able to talk, being able to tell your story, and being heard and validated. And so the narrative aspect of things is, I feel, a little bit, comes a bit more naturally for me.
And how do you tailor your counseling methods to different age groups, like, kids, teens, adults, seniors?
I wouldn't actually say it is tailored to age groups.
So you can use CBT or narrative in any of these groups?
Yeah, because I think if you have, a teenager that's quite bright, I mean, most teenagers are bright, but that's quite aware of what's happening for them, then you can draw on that by using the appropriate modality versus somebody who maybe needs a bit more stirring as far as what's really happening.
Right. And do you see children and teens?
My youngest client is about 12 and a half.
Okay.
So, and my oldest is senior.
Yeah.
So
That's great.
But I mean, the list of people seeking counseling out there in just the Tri-Cities is huge. And the cost for counseling is, I might add, generally out of reach, out of pocket.
Yeah.
So myself, along with others, do offer reduced fee, which people appreciate because unless you have benefits, the counseling fee is just...
It's a lot. Yeah, absolutely. What kind of advice would you give someone who's hesitant about seeking therapy?
What kind of advice would I give to them? I would probably sort of bring the perspective in the fact that, if life's not going too easy or days are tough, what's the risk in trying to do something to help things go along easier? Generally, once people come in and start to talk, they find relief just by having somebody to unload on.
Yeah, exactly.
Essentially.
What types of, if anything specific, any mental health trends or challenges unique to the Tri-Cities that you've been seeing?
I haven't worked in the counseling field in the Tri-Cities for long enough to sort of make that judgment, but I do know that, since the pandemic, provincially, there's a 59% increase in youth and children seeking mental health treatment. So the numbers have just shot up.
Yeah.
So if that was provincially, then you can only imagine it would affect the Tri-Cities as well.
Yes, yes.
And also the online effect of bullying and social media addiction, technology addiction that a lot of parents face most parents actually, are things that we didn't deal with 20 years ago.
Right, exactly. No.
Or even 15 years ago. So,
what do you think some of the gaps that, still need to be addressed are?
in those particular areas, well, of course, we can't change the pandemic. I think the remote learning really had an impact because people got comfortable, and not just kids and youth, but even adults got comfortable working from home. As far as the social media and technology, challenges, I don't really know if there's a way to get away from that aside from giving kids tools that they can use to find, enjoyment and connection elsewhere.
Right.
But when you have a group of peers that are all at home on their electronics, they're not together connecting, so they don't get that same enjoyment because they don't experience it. So I don't totally have a clear answer for you on that, but I think it's kind of a complex problem for sure.
It is. Are there any local programs or initiatives that you would recommend for people that are seeking mental health support?
I mean, for children and youth, there's the mental health center down in Port Moody for youth and children. There's the START program, which deals with more so for the young people that are in crisis and dealing with self-harm risks. It's a short-term program. There's the Foundry BC, which is available online, and it's quite resourceful. There's Share Family Services in Port Moody, which also offers, different programs. As far as adults go, there's not a lot. Not from what my knowledge is. I know people seeking mental health help, can go to the hospital, can go to Tri-Cities Mental Health. But as far as support groups, I mean, I'm not aware of any that are that are widely spoken about. There should be.
So how do you think that communities can better support mental health awareness and, help with reducing the stigma around mental health?
If you want my honest opinion, I think it can start with the adults because, we walk around talking about anti-bullying day and stuff, but I've heard for years adults bullying each other. And we need to set a proper example for our younger generation.
Right.
And in order for change to be made in mental health, as an example, we need to lead by example and be kinder. There's far too much going on in the communities that is not necessary. That's one example.
And do you think that schools and the workplace should play a role in promoting, mental wellness?
The schools should be, and I know this from dealing with my own kids when they were in the school system in Coquitlam. I hear about it on the community groups now. Kids are being bullied in the school system. The schools are not doing anything about it.
Right.
And it's been happening. My kids have been out of the school system now for 8 to 10 years, and it's still happening. And so we have kids being impacted by bullying and growing into young adults and then adults. So, and as far as the workplace is concerned, I think definitely kind of taking more care in allowing for mental wellness while people are working is important.
Yeah, I think so too. We're always hearing about self-care. I was talking about it earlier and how important it is and the work-life balance and things like that. But what are simple self-care practices that people can integrate into their daily lives just to even, earlier someone said, for my well-being after my job or before my job, I need to exercise. Exercise is so important. But, even simple things like going for a walk and getting some fresh air, like what are some of the things that you would recommend?
So you just mentioned it, going for a walk. It sounds so cliche and it doesn't involve, going to work out per se, but I can almost guarantee that if you go for a walk, you're not going to regret it once you're out there.
Right. Even though it's this cold? Bundle up.
Bundle up. bundle up, just like we were told when we were little.
That's right.
The other thing, there's things like even running a bath, making your favorite cup of tea, or hot chocolate, which is one of my favorites. Just setting the intention, even if it's for 15 or 20 minutes. It doesn't need to be 2 hours. But
Right.
the self-care, act of self-care, it's not about what you do, it's the intention behind it.
Mm-hmm.
You might run a bath and intentionally enjoy that instead of doing it out of habit. So it's really not about what you do, it's the intention that you set. But yeah, going for walks are, I wish I had brought statistics on that, but.
Oh, that's okay. How do you think that our loved ones can help, a person who's struggling? What kind of support can they lend to people?
I think it could be as simple as slowing down a little bit for those around us. Work, life, everything is busy. We're always on the run. We have technology in front of us all the time, and those closest to us often pay the price. And I think as far as our loved ones, those that we live with, those that we're closest to, just taking, even if it's 10 minutes to check in and connect. Because before we know it, a week's gone by or 3 weeks has gone by and life happens.
Yeah, exactly.
So I really, I'm a believer of taking that time, making that time.
So Jess, what do you think that some of the signs are in someone that might need professional help? Like, think about your own story, and did you sort of internally think, gosh, I need help, I need to talk to someone, I need something, you lost your sister at such a young age, and when did things start kind of, seeming like they were going out of control for you?
Well, the scary part is because I was only 12 and a half, I actually didn't recognize anything. Like, looking back, I was just in the throes of grief and trauma.
Yeah.
And
how old was your sister?
She was almost 20. And we grew up in Coquitlam. So, I mean, this is going back almost 36 years. So, looking back, there isn't anything I would recognize because I was a kid.
Right.
And kids are not supposed to deal with that stuff. So, but as far as somebody else maybe having a family member who has that they have concerns about, there's things from, excessive emotions, crying a lot, not sleeping, withdrawing from anybody around them, not having an appetite, missing work, missing school. There's those sort of types of behaviors that could be an alert for, hey, is there something else going on? And if we can catch people before they hit crisis point, there's the thing I was reading a note online that we're paying for mental illness in the most expensive way possible because people are not getting help or they're not able to get help until they've reached crisis point. So if people can help each other recognize sooner or reach out sooner, then maybe we can kind of help bring that crisis point.
So do you think that, you talked about being 28 and, someone telling you at 30 that you really didn't need to be on all of these meds, and like during these times of your adulthood, were you advocating more and more for yourself, would you say, or was that something that wasn't quite there yet?
So by the time I hit 20, I was, because I was told in my mid-20s I was going to be permanently institutionalized by the time I was 40. So I really started being vocal about the fact that I didn't need the medications I was taking. But unfortunately, I was told by professionals in the hospital more than once that denial is the number one symptom of bipolar. I can't even articulate those words anymore because they're so unbounded. So I became quite vocal, but it didn't work. So when my back literally fell apart at age 30 and I needed emergency back surgery, the doctor that came in to see me asked me what all the medication was for that I was taking. And I told him I was bipolar, and he said, no, you're not bipolar. I've been observing you. And, anyhow, to make a long story short, he took me off of it all. So I had definitely been vocal, but they would just up my meds, et cetera, et cetera.
Right, because denial is the number one thing of bipolar in their world, right?
I would love to have that tattooed on my arm because I was clearly right. And, again, as I said in the beginning, it's not just me. I'm not the only one. I went through this, 15, 16 years ago. And I'm not the only person that experienced that.
Right. How has the pandemic and post-pandemic world changed the way that people approach mental health, do you think?
I think that people are more, well, I think, first of all, there's a lot more people suffering from mental health issues since the pandemic. I think that isolating ourselves has become more normalized because, that's what we have to do in 2020 and 2021. So I think that's a very fine line between what's healthy and what's almost dangerous. So as far as how it changed mental health, I think it's talked about more. I think people are more aware of, the impact of mental health post-COVID, but I also think that there's a lot more people suffering post-pandemic. So it's kind of, one cancels out the other almost.
So if there was any improvements that you wanted to see in mental health services in the Tri-Cities, what kind of improvements do you think that we should be making?
Can I be fully transparent with that?
Oh yeah, of course.
So if you're going to keep, building more places to live for people, most specifically more towers where you're bringing in, dozens of families, we've only got 75 beds for inpatient care for psychiatry. We need more resources to match the people that are coming into our community.
Well, I mean, one sort of rebuttal to that, for example, would be, well, I'm going to be living in this building. I don't want any beds here for people that have mental health problems, right? There's that stigma. Again, not in my backyard. I don't know if I would want that or anybody would really want that. But so that causes another problem. It's enough that the developers out there now, they're creating these high-rise towers. Like you said, dozens of people are living there, but they're trying to also include the affordable component to that, right? But yeah, what about the people that don't have anywhere to live? They're all on the street. We see it all over the place.
Yes.
There's homelessness. The population of homelessness is growing in the Tri-Cities, and a lot of that is mental health. They just don't have the resources of knowing where to go.
They don't. And actually, interestingly enough, in 2014, I started a group called Christmas Bags of Hope. We were doing bags for the homeless at Christmas. It went on every year. The community online grew, the support grew, and this year was the first year I didn't do it. Why? Because back in 2013-ish or so, the number of homeless on the street was under 50. I read the number 40. But I mean, now it's over at least a couple hundred.
Yeah.
And so I was just feeling, not that there wasn't any hope left, but it was just not, it wasn't working. What I had hoped wasn't working. And so going back to your point, the people ending up on the street, it's just a cycle. It's just a cycle. The other piece being the affordable places that they're building. The affordable rent for a 2-bedroom condo in one of the buildings going up, I read, was $1,700 or something. And I mean, on the community group, people are throwing their hands in the air saying, since when is that affordable? So developers' idea of affordable is not, I don't think, realistic. I think you might agree with that.
Yeah, absolutely. What other things, do you want to share with our viewers, whether that's your story or some more statistics that you brought with you? I'll just give you the platform here. Could you share a little bit more?
I think we've kind of covered a lot of different information. I just think that to share what I could share would be, for people to keep speaking out about what's needed, whether it's services and resources, because you're not wrong, it's needed, and it was needed years ago, and the problem is not going to get any better. Because mental health is, I experienced it when I was 11 with my sister, so I've grown up with the challenges and the results of mental health. So I would just encourage people to be vocal. I would encourage the local politicians to keep pushing for change as well. If you give me the mic and the floor to talk, we would be here for far too long. So.
No, not a problem at all. Thank you. I really appreciate your time and your insights. You're listening to Jessa Turner with TRUESELF Counselling, a newer counselor in the last year, but she's gone through a lot through the system. And hopefully, if you're looking for any type of therapy or mental health help, you can seek that out right here in the Tri-Cities. My name's Cathy Cena. Thanks so much for watching Catching Up with Cathy.